my name is Sarah. I'm a student nurse. Today we're going to be doing a cranial nerve assessment. The first cranial nerve is the olfactory, which is your sense of smell. We're not going to be testing for that today. The second is the optic cranial nerve. We won't be doing the first portion of visual acuity, but if we were, it would be similar to how you would do it at your eye doctor. I would have you put on your glasses or contacts, and we would stand about 20 feet away from the chart and be hanging on the wall. I'd have you cover one eye and read the lowest line that you can. Hopefully it would be around 20/20. If you were to miss 3 or more, I would have you go to the line above. And then we would repeat with the other eye covered, and then do it once without either eyes covered. So the second portion of the optic is your visual field. So I'm going to wiggle my fingers from behind you, and you just let me know when you can see it.
Okay. Yep. 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 Yes. Yes. Yes.
Okay, so your visual field is intact. The next portion of the assessment is cranial nerve 3, the ocular motor. So I'm going to move my pen light, and I'm going to have you follow with your eyes only, okay? Okay, good. There was no nystagmus, there was no extra movement, so your visual field is intact. The next portion of cranial nerve 3 is the pupillary light reflex. So I'm going to shine the light kind of in your eyes and check your reaction. Okay, good. Okay, good. Both reacted. So that one is intact. Your pupils are round and equal in size. They're about 3 millimeters in size. The next portion is accommodation. So just follow my pen light with your eyes only. Okay, they were able to accommodate. They did the downward inward movement. So cranial nerve 4, the trochlear, is intact. Cranial nerve 5 is your trigeminal, and there's 2 portions to this. So the motor portion, I'll have you open your mouth against resistance. Okay, good. And then I'm going to have you move your head side to side against resistance. Good. Good. The second portion would be your sensory, so we would test for sensation of the face, scalp, your corneas. I would assess your mucous membranes and your nasal membranes with a cotton ball. So, okay. In that case, cranial nerve 5 is intact. Cranial nerve 6 is the abducens, which is lateral movement of your eye muscles. We already did that when we tested your ocular motor, so in that case, cranial nerve 6 is intact. Cranial nerve 7 is your facial, so we're going to be checking your muscles of mastication. So go ahead and make like a chewing movement. Okay, and then close your eyes for me. Okay, you can open them. And then say a 2-syllable word. So just repeat the word Starbucks to me.
Starbucks.
Okay, good. Your labile speech is good. And then smile for me. Frown. And puff out your cheeks. And then raise your eyebrows. Good. So the next part of cranial nerve 7, I would have you test for taste. So salty, sweet, sour, and it would be on the anterior 2/3 of your tongue, but not for today's assessment.
Okay.
The next portion would be to test for tears, which we're also not going to do today, but I would stimulate your cornea with a cotton ball. And I would also test for salivation, so I would give you a sour food, and we're not going to do that today, but you would salivate.
Okay.
So in that case, cranial nerve 7 is intact. Cranial nerve 8 is the acoustic nerve, so your hearing. I'll perform a whisper test on you, so go ahead and cover up one ear for me, and then repeat the word that I say back to you, okay?
Okay. Starbucks.
Okay.
Starbucks. Starbucks.
Okay, so your hearing is intact. We would also test for equilibrium, but we're not going to do that today. We'll do that during your head to toe assessment when we test for gait. So cranial nerve 8 intact. Cranial nerve 9 is the glossopharyngeal. So I'm going to have you open up your mouth and say ah.
Ah.
Okay, and I'm going to put some gloves on. We're going to use a tongue depressor. I'm going to elicit your gag reflex. Good. Cranial nerve 9 is intact. And then cranial nerve 10 is the vagus nerve, so go ahead and state your name and date of birth for me.
My name is Victoria Becker. Birthday January 7th, 1993.
Okay, and there was no hoarseness as you were speaking. Can I have you swallow for me? Good. So cranial nerve 10 is intact. Cranial nerve 11 is the spinal accessory. So I'm going to have you, I would have you move your head side to side against resistance, but we already did that. So then I'll have you move your head up and down against resistance. So go ahead and move up. Good. And then move down. Good. And then I'm going to have you shrug your shoulders against resistance. Good. So cranial nerve 11 is intact. And lastly, we have cranial nerve 12, the hypoglossal. So I'll have you stick out your tongue midline. Good. And then move your tongue side to side for me. Awesome. So cranial nerve 12 is intact, and that completes our cranial nerve assessment.
Thank you.